Hey, you guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with any of our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review books, videos, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I have been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, and I would love to assist you as well as needed. As always, y'all know I like to get into my disclaimer and reminder before getting into any of our questions because y'all know there's no absolute in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed based on the guidelines that are currently being tested on the AAMP as well as ANCC exam. Now, if I am teaching on any videos, teaching and providing videos on anything that we currently do in practice, just know that I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a patient presents to the office with complaints of weakness and fatigue. The nurse practitioner is reviewing labs, and they are as follows: hemoglobin and hematocrit are below normal range, MCV is 72, MCHC is 29. Based on these findings, what are the best differential diagnoses at this time? Is it A, B12 deficiency and folate deficiency anemia, B, iron deficiency anemia and thalassemia, C, thalassemia and anemia of chronic disease, or D, B12 deficiency and iron deficiency anemia? Take a moment and tell me what you got in the comments, you guys. All right, you guys. So, I always recommend reading the stem of the question first so it allows you to slow down and truly answer what is being asked. So, here the stem of the question states based on these findings, what are the best differential diagnoses at this time? All right, and you know my rule. If we are trying to find a diagnosis, we need to run it back and see what the assessment findings showed, right? So, this patient came in, they're complaining of weakness and fatigue. The nurse practitioner is reviewing labs, hemoglobin and hematocrit are low, so we're thinking some type of anemia. And the weakness and fatigue, that follows suit of what we would think with someone with anemia, right? The MCV is 72. That's what microcytic, right? Because it's less than 80. And then MCHC is 29, so that's hypochromic because it's less than 31. Remember, 31 to 37 is the normal range for the MCHC, and 80 to 100 is the normal range for MCV. So we have microcytic hypochromic. So what differential diagnosis do we start to think that falls into that criteria? So the best answer choice would be B, iron deficiency anemia and thalassemia. Remember my 2-1-2 rule for anemia. And if you don't know what I'm talking about, go check out my anemia video to kind of help you tie it together. But we know there's 5 common anemias, right? And so the two that falls into that lower scale of the microcytic hypochromic range is your iron deficiency anemia and thalassemia. Okay? So B is your best answer. All right, question number two states the nurse practitioner has iron deficiency anemia and thalassemia as differentials for this patient. She is reviewing an iron profile and notes that the ferritin and iron levels are low. Based on these findings, what is the best diagnosis? Is it A, iron deficiency anemia, B, thalassemia, C, anemia of chronic disease, or D, anemia of an unknown origin? Take a moment and tell me what you got in the comments, you guys. All right, stem of the question states, based on these findings, what is the best diagnosis? So just like on the previous question, I was telling you, hey, microcytic hyperchromic, we are down to now differentials of iron deficiency anemia and thalassemia. But when you get to this point, you need to be able to differentiate between those two, right? So now the nurse practitioner has looked at the iron profile and notes that the ferritin and iron levels are low. Instantly, you should think A, iron deficiency anemia. Because if we present with a low hemoglobin hematocrit, we're thinking anemia. The MCV and MCHC is low, microcytic, hypochromic. We're now thinking IDA and thalassemia. Now we look at a ferritin and iron level on that iron profile and see that those are low. That is iron deficiency anemia. Our ferritin, which is our iron stores, and our iron levels are going to be low because we are deficient in iron, right? With thalassemia, your ferritin and your iron will be normal. So again, your best answer is A. And then lastly, question number 3, the nurse practitioner has confirmed a diagnosis of iron deficiency anemia. What is the best treatment option at this time? Is it A, ferrous sulfate 325 milligrams daily, B, ferrous sulfate 325 milligrams 3 times a day, C, iron supplements weekly, or D, no treatment at this time, have the patient to follow up and reassess in 1 week? Take a moment and tell me what you got in the comments, you guys. All right, so stem of the question states, what is the best treatment option at this time? So we're trying, what are we trying to treat? Remember, I tell you, if they ask you for a treatment, you need to run it back and figure out what the diagnosis is. Look and see if they have provided you with a diagnosis. If not, then you got to take it back a step further and see what the assessment findings are so that you can determine a diagnosis or a differential diagnosis to even consider what you're treating, right? So we know we worked with this patient. They came in, they were feeling weak, they were fatigued. We assessed their CBC. We saw that their hemoglobin hematocrit were low, started thinking anemia. We assessed to try to determine what type of anemia. Their MCV was low, their MCHC was low, so it was microcytic hyperchromic. We knew it had to be either iron deficiency or thalassemia, right? So we dug a little bit deeper, looked at the iron profile, saw that the ferritin levels and the iron levels were low. So we knew that our differential was now a confirmed diagnosis of iron deficiency anemia. So then once we got to that standpoint, we now need to know how to treat those patients. And so you want to treat iron deficiency anemia when you're first noting in office with B ferrous sulfate, 325 milligrams, 3 times a day. Okay. So 325, 3 times a day. And again, I'm trying to incorporate these things so you're walking through the full picture because I'm trying to train you to study in this fashion. Because again, y'all know my soapbox: assessment, diagnosis, evaluation, treatment. Study in that fashion. We practice in that fashion, we document in that fashion. Our soap notes is just the same thing. This is how the boards assess you as well. So just start to train your mind and study it in this way, okay? And as always, I hope you found this helpful, but be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. And if you need any other things that I offer, my review book, either ebook or paperback, is linked in the bio of this channel. My self-paced review course, where I'm teaching through each system for preparation for the family and adult GERO review students preparing for AAMP and ANCC, is also linked in the bio of this channel. My upcoming 5-week review course, for those of you who have signed up, I look forward to working with you guys. We start next week on Monday. The link to access will be released in 2 days, so that you'll be able to download your workbook, look at the syllabus, and all of the things. So, for those of you who signed up, be on the lookout for that email. And I'll continue to announce and tell you when I actually release it. And then, lastly, I offer the one-on-one sessions, either for weaknesses that you need to really work in on. If you're looking for exam readiness assessment with me, that's also an option of the one-on-one sessions. And then the custom plan is where, if you've had an unsuccessful attempt, we look at that, we structure studies, and I work alongside with you to prepare to get you successful on the exam. Okay. So if you need any of those resources, feel free to reach out to the nursing studio at 803 400 6864. You can also text that number or shoot us an email at the nursingstudio1 at gmail.com. But as always, happy studying. Bye, y'all.